Today we will study about fever from the chapter 18 from the Harrison's textbook. Fever, normal core body temperature of our body is 36.6 degrees Celsius. According to diurnal variation, AM temperature is always less than PM temperature. If AM temperature is more than 37.2 degrees Celsius or 98.9 degrees Fahrenheit and PM temperature is more than 37.7 degrees Celsius or more than 99.9 degrees Fahrenheit, then we call it as fever. Other variation of fever. In summer, there is less temperature. In winter, more temperature. Second, as age increases, core body temperature decreases. Third, affected by comorbid conditions like cancer, increase, hypothyroidism, decrease, hyperthyroidism, increase. Next in females at the time of ovulation. Temperature increased by 0.6 degrees Celsius, that is 1 degree, and stay at that level only till menses occur. Now the sites for measurement of temperature. Best site is lower esophagus. Why lower esophagus is the best site? Because it is closely reflecting the core body temperature. More than. And next is, what about rectal temperature? Rectal temperature are 0.4 degrees Celsius higher than the oral. Then tympanic thermometer. They are not useful and they are not used now. They are not so sensitive and they do not reflect the core body temperature. Okay. Now the pathophysiology for induction of fever. First of all, there is infection or there is any microbial toxin or mediator of inflammation which stimulate monocyte, macrophage or endothelial cells. After the macrophage stimulation, there is release of pyrogenic cytokines. This is very important. Pyrogenic cytokine or known as endogenous pyrogens. Endogenous pyrogens are interleukin 1, interleukin 6, TNF alpha, interferon gamma. They are released in the circulation and reach the CNS. In the CNS, they stimulate hypothalamic endothelium. From the hypothalamic endothelium, there is the release of prostaglandin. Prostaglandin E2 is most important mediator for fever. When prostaglandin E2 is released, it stimulates the prostaglandin E2 receptor present in the hypothalamus, which lead to release in cyclic AMP. And cyclic AMP elevate the thermoregulatory set. This is the main mechanism behind the induction of fever. Now, Once the hypothalamic set point is reached, neuron in vasomotor center, they are activated and they will stimulate vasoconstriction in peripheries to preserve the heat. So there is decreased heat loss from the skin. Then second mechanism is shivering. Shivering increases the heat production from the muscle. Shivering is not required mechanism of heat conservation, raise the blood temperature sufficiently. So two main mechanisms for increasing the heat conservation is vasoconstriction and shivering. And these two mechanisms continue until the temperature of blood matches the new thermostat, which has been set by the hypothalamus. Once that point is reached, hypothalamus maintains the temperature at that febrile level only. When the hypothalamic set point is again set downward, then process of heat loss starts through vasodilation and sweating. This is the main mechanism of induction of fever. Now we will learn about patterns of fever. Like in the malaria, Plasmodium vivax. Fever is every third day. Plasmodium malariae. Fever is every fourth day. What is Pal-Abstin fever then? Pal-Abstin fever. In Pal-Abstin pattern of fever, fever lasts for 3 to 10 days. Then there is a period of afebrile phase. Afebrile phase is also 3 to 10 days. Then again there is a febrile phase of 3 to 10 days. This type of fever is seen in Hodgkin's lymphoma. Okay. Then there is cyclical neutropenia. What is cyclic neutropenia? Cyclic neutropenia is fever every 21st day. Okay. These are the main patterns of fever. Now, there are two terms related to fever. One is hyperthermia and one is hyperpyrexia. Hyperpyrexia. Causes of hyperpyrexia is microbes, toxins, or if there is any pontine or brainstem bleed. Causes of hyperthermia. Hyperthermia is due to increase in environmental temperature, that is like heat stroke, or it can be due to increased heat production by muscles, like malignant hyperthermia. Basically, hyperthermia occurs due to uncontrolled increase in body temperature. That exceed the body ability to lose that heat. Okay. Mechanism in hyperpyrexia is same that of fever, that is increase in hypothalamic set point. But in case of hyperthermia, set point is not elevated. Hypothalamic set point increase when there is increase in prostacyclin. There is no increase in prostacyclin. PGE2. Hyperthermia definition is more than 40.5 degrees Celsius. This is more than 41.5 degrees Celsius. Hyperpyrexia. Okay, or more than 106.7 degrees Fahrenheit. Now, hyperpyrexia is due to increase in prostaglandins. So, treatment can be NSAIDs. There is no role of prostaglandins, so there is no role of NSAID in treatment. Treatment is hydrogen therapy. So, it is very important to differentiate between hyperthermia and hyperpyrexia or fever. Since hyperthermia can be fatal, and it does not respond to antibiotics. It responds only to hydrogen therapy, water therapy. So in management of fever, we usually use paracetamol, acetaminophen, ibuprofen. But in children, don't use aspirin, as it can lead to Ray's syndrome. One important thing associated with fever is increase in heart rate. When there is increase in 1 degree Celsius temperature from 37 degrees Celsius, heart rate increase by 15 to 20 per minute from baseline. So there is a term relative bradycardia, also known as Fazet sign, in which heart rate does not increase in proportion to temperature. There is relative bradycardia. Causes of Fazet sign. There can be infectious causes, there can be non-infectious causes. In infectious causes, mostly intracellular organism, but some organism where characteristic Fazet sign is positive is typhoid fever, Legionella, Coxiella burnetii, Leptospira, Brucella, Mycoplasma, and viral fever. In non-infectious causes, first is drug-induced fever. There will be no increase of heart rate. Then, in case of factitious fever, then what is factitious fever? Factitious fever is self-induced fever. For example, distilled water injection or aniline eczema. Then is fraudulent fever. Fraudulent fever is body temperature is normal. For example, this is only thermometer reading. Someone has put the thermometer in T. If patient is simultaneously using beta blockers. So this is all about fever.